We'll quickly move to the next aspect of Tetralogy of Fallot. I'll get to talk about the complications. That's like if somebody has this, congenital heart defect, and mostly complications come in when signs and symptoms are not being handled, so it leads to complications, right? So if complications come up in Tetralogy of Fallot, what are the possible complications that such patients can be having? So for Tetralogy of Fallot, this is a pictorial representation. And you can see the various defects in the Tetralogy of Fallot, which we have discussed about it repeatedly. So for the complications that children with this will be having, first of all, Tetralogy of Fallot is what? An issue that have to do with what? 4 defects. Okay, hence the name Tetra. So we have the pre-surgical complications, we have the post-surgical complications. Now, pre-surgical complications, that's like before the surgery. The person is having what? Low oxygen delivery to cells. That's what? Hypoxia. So the cells are becoming bluish, like the body, whole body, skin, mouth, the hands, the legs are becoming bluish. Third spells, alright, sudden episode of deep cyanosis, delayed growth and development, seizures or even stroke. Okay, then after surgery, okay, that's like complications of surgery. So residual ventricular septal defect. So this one, there was an incomplete closure of the heart. So there's some small blood leakage. Pulmonary valve regurgitation. The heart is now becoming beaten somehow because of surgical scars, heart failures, conductive abnormalities, inflammation of the heart muscles, that's endocarditis, then sudden cardiac death. Okay, so these are the various complications classified into the ones before the surgery and the ones after the surgery.